Hello guys, welcome back to my channel. Myself Dr. Gargi Shet and I passed FMGE in January 2023. So today's video topic is, are you in between or confused to skip medicine or not to skip medicine? So guys, skipping any subject is really not a good option for FMG or you are preparing for any exam. So in this video, I am trying to give you some high yield points and topics that will definitely help you to score more in your exam. As we all know that medicine is a lengthy and conceptual subject and it's really not possible to start medicine now because we just have 60 days for exam, and doing whole medicine as well as revising it takes a lot of time, I know. And that's why I am giving you some high yield points, topics as well as tricks which I use while my preparation. So definitely this will help you to score some marks in medicine. So yeah, without any further delay, let's get started. So at very first we are going to see metabolic and respiratory acidosis and alkalosis. A lot of student finds it difficult, but it's really very easy if you will understand some tricks. So guys, see, as we all know that acidosis कब होता है जब pH decrease होता है, and alkalosis कब होता है जब pH increase होता है. So see, if pH is less and CO2 is also less, both arrows are going to the same direction, same है, तो that is metabolic. And if both arrows are going to reverse direction, that is respiratory. So it's very easy. In exam they will ask you pH is decreasing, CO2 is also decreasing, then definitely same ME. ME is for metabolic. So this is metabolic acidosis. So you can solve this kind of tricks. So yes, for that you have to remember the normal value of pH and CO2 as well as try to see bicarbonate levels. Let's try to solve this MCQ. A 35-year-old male presents to the emergency in a drowsy state. His ABG's analysis are pH, PCO2 and PO2 as well as HCO3 they given, and what is the likely diagnosis. At C, normal range pH is 7.35 to 7.45, PCO2 is 35 to 45 mmHg, HCO3 is 22 to 26 milliequivalent. In question they gave pH is 7.25, 7.25, that is it is decreasing. So it's acidosis, and PCO2 is 60, that is it's increasing. So it is, the arrows are going in reverse direction. So it is respiratory acidosis. So yeah, let's see the option. So respiratory acidosis एक ही option है. Let's mark. Oof, wow. So yeah, try to practice more MCQs. I know CBS is most difficult system, but there are some messages जो एग्जामिनर बार बार पूछ रहे हैं, तो उनके बारे में पता होना जरूरी है. So yes, we have to see the 3 ECGs first. Atrial fibrillation, multifocal atrial tachycardia and atrial flutter, that is also called sawtooth wave. In atrial fibrillation, there is irregular RR interval and P wave is absent. In atrial flutter, we can see sawtooth waves, and multifocal atrial tachycardia, we can see irregular RR interval and P wave varying morphology. So the next one is PSVT, that is also called AVNRT, paroxysmal supraventricular tachycardia. So in this ECG we can see ST depression and narrow QRS, and the treatment is adenosine. Next is Osborne wave. Osborne wave are seen in the patient of hypothermia and hypercalcemia, that is called G-point wave. In ventricular fibrillation, we can see uniform twitching. In ventricular tachycardia, as by name they mention tachycardia, so we can see heart rate up to like 200 BPM and wide QRS complex. Josephson sign is seen in ventricular tachycardia. Next is about electrolyte abnormality, and in that there is hyperkalemia and hypokalemia. So hyperkalemia is tall tented T wave and ST elevation, and hypokalemia ST depression and depression of T wave, that is T wave inversion. So we can see hypokalemia and hyperkalemia ECG findings, T wave inversion, hypokalemia. tall tented T wave is hyperkalemia. So definitely this ECG will give you 2 to 3 marks. So we saw atrial fibrillation, multifocal atrial tachycardia, atrial flutter, PSVT, Osborn wave, that is J wave seen in hypothermia, hypokalemia, hyperkalemia, ventricular fibrillation and ventricular tachycardia. So by doing this you will definitely get 2 to 3 marks. 1 mark in CVS is definitely all the time favorite question of examiner regarding cardiac tamponade and tension pneumothorax. So we have to remember some things about cardiac tamponade, that what is Beck's triad. Beck's triad is hypotension, normal breath sound and elevated JVP, that is non-pulsatile. In tension pneumothorax we see hypotension but breath sound is absent and there is a shift of mediastinal to contralateral side. So this will definitely give you 1 mark. So in this way in ECG you can score 2 to 3 marks and 1 mark in this question. So 3 to 4 marks or 4 to 5 marks you can score in CVS. Next system is CNS, most difficult, yet you can score 4 to 5 marks. How to score 4 to 5 marks in neurology? The first thing you have to do is meningitis chart. You have to remember meningitis chart. So fever plus headache plus nuchal rigidity is equal to meningitis. So in that bacterial, tubercular and viral meningitis you have to see. So write down this chart by your own handwriting and stick it in front of your study table. Next one is myasthenia gravis and you have to compare it with Lambert-Eaton syndrome. As myasthenia gravis is type 2 hypersensitivity, so we can see decremental response in myasthenia gravis as well as incremental response in Lambert-Eaton syndrome. So what kind of question come in exam? That they give the history of patient present with ptosis, that is worse in evening, and showing the improvement, that is diurnal variation is present, as well as workup with the ice pack test. So yes, that is myasthenia gravis. You have to also remember about hemorrhage. If the history of thunderclap headache is given, that is SAH, that is subarachnoid hemorrhage. If that is EDH, that is seen in the bike accident patient, and MMA lucid interval is present, treatment is Burhole. And in SDH, we mostly see the history of fall in bathroom and the source is cortical bridging veins. So one question definitely come from hemorrhage. Nowadays examiner is trying to asking about GBS, that is Guillain-Barré syndrome type 4 hypersensitivity. So mostly the history of patient is given fever, blood, mucus in the stool. So remember that it is by Campylobacter jejuni and 7th nerve palsy. The treatment is quinolones. Next one is migraine and headache. So we have to remember by mnemonic POUND, that is pound, pulsatile headache, 1 day illness, unilateral, most of the cases, nausea and dibbling in cataract. So in stroke, at least try to go through Weber syndrome, that is the 3rd nerve palsy, Millard-Gubler syndrome, that is 6th nerve palsy plus ipsilateral 7th nerve palsy, lateral medullary syndrome and medial medullary syndrome. Just try to remember which kind of nerve palsy it is. As well as once go through transient ischemic attack. So in this way you will do all these topics. You will definitely score 4 to 5 marks in neurology. In rheumatology, try to remember all the antibodies. In which disease we can see which kind of antibody. In SLE we see anti-DNS antibody, anti-Smith antibody. Like that, try to remember this all. The last one is endocrine system and we can score 3 to 4 marks in that by doing diabetes mellitus, diabetic ketoacidosis, diseases of parathyroid gland, in which disease aldosterone is increased and decreased, as well as Cushing syndrome and acromegaly. You have to see in detail. So here I wrote diabetes mellitus type 1, type 2, type 1.5 and Moody. So where insulin is increasing and decreasing, the reason and the treatment. The next is disorders of parathyroid and treatment, in which calcium is increasing, phosphate is decreasing, SAP is increasing or normal. Try to remember this chart. The next is Addison's disease, primary autoimmune, secondary pituitary damage, tertiary hypothalamus damage, and crisis, that is Waterhouse-Fridley syndrome, sudden stoppage of steroids. So yeah, C, in which ACTH is increasing or decreasing, hyperpigmentation is seen in all types as well as drug of choice. When aldosterone is increasing, there is Conn syndrome, and decreasing, there is Addison's disease and their treatment. And the last one is about Cushing syndrome and acromegaly. So yes, that's it for today's video, as I tried to give my best to giving you some high yield points, and if you will revise that at least 2 to 3 times, that will definitely help you to score good. And whatever sources, notes and pictures I tried to show you, that was everything from Pre-Pladder by Dr. Deepak Marwa sir. As he is the god of medicine, you should definitely watch rapid revision videos of him in Pre-Pladder app, and that will definitely help you. At least watch that once and revise at least 3 times. All the very best for your exam. Thank you so much. For such kind of more videos, don't forget to like, share and subscribe.